Welcome to the Potter Blog site, August 27, 2013. Senior officials in the United States government have a solicitation out to track lung ventilator usage nationwide in near real time. And this is the solicitation for it that came out yesterday. And here's a direct quote from the solicitation that'll help you understand what the purpose of this is. And let's zoom in just a little bit. It says, "This requirement is intended to help inform senior U.S. government leadership decision-making, leverage private sector knowledge without being intrusive, build situational awareness to inform rumor control, and identify surge and preparedness strategies." And let's look at one more quote here. And here's the contracting government agency's key statement here. They have a unique capability. This unique capability is of particular importance when assessing ventilator capacities during a potential influenza outbreak. And we're going to show you here why this is so important. From our website, from our blog site. Let me zoom in on this just a little bit and make it, just in case somebody's trying to read it. It says, "A shortage of ventilators will likely be the first public sign that the expected H7N9 pandemic is in progress. By delaying the public's knowledge through rumor control, it provides a key time-based logistical advantage for health authorities to enact quarantines and to place controls on critical supplies and infrastructure that the public may rush out to buy or overwhelm when they become aware that there's an ongoing H7N9 pandemic. So, under such conditions, the first indication that an observant medical staff may have that an H7N9 pandemic is going on is when hospital administrators direct level loading of ventilator usage across a city or region. And what this does is it disguises the number of patients in need of ventilators. Now, they can't do this for too long because there are very few ventilators actually available out there. And so this is why ventilators are a key item to track, especially with H7N9 bird flu. Item 1, nearly 100% of adults presenting with H7N9 infections will die without a lung ventilator. If you do happen to be one of the lucky first people to be infected with it as an adult, you only have a 30% chance of dying. 2, again, the supply and availability of ventilators is very limited. Even a large city may have no more than 100 ventilators for 1 million people. So you can see why this would lead to a large number of deaths. So a shortage of ventilators may induce public panic. Now, if you want to understand the government's rationale behind this desire to control knowledge and to do so without people being aware of it, and that was one of the key quotes in the solicitation, without impacting their knowledge. Let's see here if I can scroll up to it real quick. It says, leverage private sector knowledge without being intrusive. I mean, if you got government agents breathing down your neck to find out about what's going on in your hospital, you know something's going wrong. So that's why they want it to not be intrusive. Now, if you want to understand why the government wants to do this and why this time-based logistical advantage is important, rent the movie Contagion. Now, we're not alone in recommending this movie to practice or to understand what the government's going to do in the event of a H7N9 pandemic. Recently, there was a nationwide drill of zoos in which they directed zoo directors, let me zoom in here on this, which included watching the virus outbreak movie Contagion as field research. This was directed by facilitators. This article is from the Chicago Tribune. Bet you haven't heard about that. So, we include a link, an Amazon link to the movie Contagion. However, as Missouri residents, we make zero money from your rental or purchase of this video from Amazon. Zero. So it's always been the case, we give links to inform. Now, this movie has only so-so entertainment value. The research value of this movie is that it basically was written for and by the CDC as a propaganda movie to try to get the public to pressure Congress to increase the CDC's budget. But the scenario they lay out in this movie basically represents the CDC's best case scenario, what makes them look in the best light if there is a pandemic. So if you want to know why they want a time advantage between when they become aware of an H7N9 pandemic and when the public becomes aware of it and what they will do in that time frame, then watch this movie Contagion.